What's up, guys? So we're going to be chatting about first aid for a heart attack. We're going to be talking about what a heart attack is. We're going to talk about how you're going to tell if someone is having a heart attack and what you could potentially do about it. And we're going to do this all within less than 2 minutes. What exactly is a heart attack? So some people think a heart attack is when someone falls over dead and that's that, they had a heart attack and died. Well, there's lots of terminology, but what we're referring to a heart attack is that when the supply of blood to the heart muscle is reduced, and so the heart muscle starts to die. Blood vessels, very small blood vessels, feeding the muscle of the heart, and when there's blockages from like plaque or too much cholesterol buildup or whatever the issue is, it could be air, it could be fat, it could be plaque, it could be all sorts of things, that is when we start having a heart attack. How are you going to tell if someone is having a heart attack? Well, there are multiple symptoms there were signs and symptoms that they might have. They might have chest pain, they might have left hand numbness or left or right shoulder and arm numbness. They could have back pain. They can become cold and sweaty and like they just become like pale. They look unwell. Their breathing can also become like short of breath. Typically speaking, it's a sudden onset. So like it's not just something that's like gradually builds. It's like a sudden change. Someone who has a gradual change can be something quite different, especially if they've been having pain for a couple of days, like 3 or 4 days, it's probably something else. But if it's a sudden onset, where is a problem? How are we going to treat these patients as a first aider? So you're going to want to calm them down, calm and reassure, and call for help, obviously. So we calm and reassure because we decrease the demand on the heart, therefore we increase the supply of the heart of oxygen, and therefore there is just the heart will do better off if you can get the patient to sit and relax and calm down. They will feel a little bit better. Get them to sit, put them in a cool area. Someone who is allowed to, we would give them aspirin. So I'm not sure whether in your country or your state or wherever you are, as a first aider, you are allowed to give aspirin, but the correct treatment for a heart attack is aspirin. It is life-saving. It makes a huge difference in the patient's outcome. So remember, call for help. You must call for help because then paramedics will get to you. You're then going to calm and reassure them. You're going to give aspirin, whatever the case is in your country. And if the paramedics get there, they may or may not put them on oxygen. That depends on a whole other list of factors. Something like your saturation would tell you if you need to put oxygen. I have a video about saturation up here. Thanks for your time and bye for now.